My name is Mr. Arupray. I'm a consultant neurosurgeon at the Royal Preston Hospital. You are watching this DVD on stereotactic radiosurgery because your oncologist and neurosurgeon feel that you would benefit from this particular type of treatment. This DVD has been produced to help you understand more about radiosurgery. It will explain what you can expect before, during, and after your procedure. Hopefully, it will help you feel more relaxed and at ease and make you ready for your treatment. Radiosurgery is a non-invasive intervention, which means it can achieve the same results as surgery without having any surgical incisions made. This means no inpatient stay, no lengthy recovery or healing, and shortly after the procedure, you can expect to resume your normal activities. Radiosurgery is a very accurate way of giving X-ray treatment to focused areas of the brain. It uses very small beams of high-energy X-rays to shrink or eliminate selective targets in the body, such as tumors and other abnormalities. It works by damaging the DNA in cells so they can no longer reproduce and grow. Eventually, the damaged cells die and the tumor stops growing. For the vast majority of patients, treatment is delivered in a single session. However, there may be occasions when the treatment needs to be delivered over a period of a few days. You will meet the team who will be looking after you during your radiosurgery. They will discuss the procedure in more detail in the clinic environment. Consent for treatment will be taken at this point after the risks and side effects involved in the procedure have been explained. It would be helpful if you could bring a list of your current medication for the consultant to review at this clinic appointment. You will be prescribed a course of oral steroids to start before your treatment, or alternatively, the dose of your current steroids may be increased. Treatment planning for your radiosurgery may be done a week before or on the same day as your treatment. Because you need to keep your head still throughout the treatment, a radiotherapy mask will be made for you. This involves taking an impression of your head from your forehead to your upper lip. It is done by applying a warm plastic sheet which shrinks as it cools to mold to your facial contour. The plastic sheet is full of small holes, so you can breathe normally through your mouth and nose. Should your oncologist feel it appropriate, you may require a special frame to be fitted rather than a radiotherapy mask, which will immobilize the movement of your head. We advise that you do not have your hair cut once your radiotherapy mask has been molded, as it can alter the exact fitting of the mask. However, if you have a beard or a mustache, you will be asked to shave it off before you attend for planning, as this helps us to get a good fit with the treatment mask. A specialized MR scan will be done which takes images of finely cut sections of your brain. Following this, a CT scan will be done with the mask or special frame in place. Using the MR scan and CT scan, the team of radiotherapy planners and physicists will map your treatment with sophisticated computer software which helps them to plan the treatment with utmost precision. Once the planning is completed, the consultant in charge for your treatment will check and sign off your treatment plan. Your treatment radiographer will guide you through the hospital and keep you informed of where you need to be for each part of the process. We advise that you are accompanied by either a family member or friend on the day of treatment. Once in the treatment room and your radiotherapy is actually being delivered, you will not feel anything, though you may hear the machine buzzing or bleeping. The radiographer will be watching you on a television monitor throughout the procedure, and the machine can be switched off at any time if you have any problems. If your planning and treatment is scheduled all on the same day, you can expect to be in hospital for a full day from 8:30 in the morning until 6 in the evening. If your treatment is performed the week after your planning visit, you can expect to be in the hospital from 3 in the afternoon to 6 in the evening, as although the actual treatment itself takes only approximately 40 minutes to complete, you will need to remain in the department to be monitored afterwards. If your treatment is planned over a few days, this time frame may differ slightly. You must not drive and should inform the DVLA of your diagnosis. You may eat and drink normally following your treatment. You may feel faint or dizzy or have a headache. It is quite usual to feel tired for some days after your treatment. Based on the location, there may be a small risk of seizures or fits. Patchy reversible hair loss may happen, although the extent of hair loss varies from person to person. The oncology specialist nurse will telephone you the day after your treatment to assess how you're feeling. If you are experiencing any symptoms, she will be able to advise you on what to do and liaise with your treating consultant oncologist. Your steroids will be tapered following your treatment. If there are any specific side effects pertinent to your individual treatment, the oncologist will discuss these with you at the time of your initial consultation. An appointment will be made to see you in the oncology outpatients clinic after 6 weeks to review your condition, and a repeat MR scan will be performed at 12 weeks to assess the response of your treatment. We are here to ensure that your treatment goes as smoothly as possible. If you have any further questions or concerns, please feel free to contact a member of the team for more information.